normal vaccine development process was actually used for these vaccines as well. It seemed to happen a lot faster than what people are used to, and it made a lot of noise. But the same procedures that normally happen in developing and testing a vaccine were all used in this vaccine as well. Kind of had a head start with this vaccine because even though we're using new technology, that technology had been looked at and studied for 2 to 3 decades. But the same vaccine procedures and testing processes occurred with this vaccine that normally happen. Those are things that people kind of believe anyway. Many people believe that vaccines, by the nature of how vaccines were developed a long time ago, and are giving you the illness because some vaccines make use of attenuated viruses, or they're quote unquote live vaccines. They feel that it's giving you the illness. And those things kind of allow people to naturally extend the line. Not really hearing some of those words like killed vaccine, killed virus, attenuated virus. And some of it is based in mistrust as well. I think that when you look at the vaccine hesitancy that happens because you feel like you've already had the illness. Well, much like some of these other illnesses that are out there, you can have more than once. Just because you've had pneumonia one time doesn't mean you can't get pneumonia again. And so the elderly that are recommended to get the Pneumovax, which protects against various strains of a bacteria that can cause infection, it's still important to do that vaccine. Some illnesses, if you've had the disease, you don't really have to worry about it as much, like chickenpox. But that doesn't mean that that person can't get shingles down the road and shouldn't still get the shingles vaccine. So having had an illness doesn't always mean that you're clear from any problems that you may have with that infection. I think the new technology mentioning RNA and people knowing that that's related to DNA makes people feel as though we're somehow changing their genetic makeup. But it's not. It's really using their genetic makeup to help the body protect itself. Because when we can have your body make some of those proteins that's not affected, not associated with having the infection, then your body can learn to recognize those proteins as something it needs to prevent and stop. So that when you are infected, your body's host defense steps up and gets the job done without having to have an infection. But it doesn't change your DNA. The messenger RNA that's found in the virus is actually destroyed by the cells themselves. But what would happen if you get the infection is that the virus would replicate in your cells and make more virus. So viruses use your DNA too. In order to make more virus. But this way, it stops that from happening so you don't get the illness. All of the vaccines are effective at preventing people from getting severe illness from the infection. And that was the primary goal, to try to decrease the number of people who are needing hospitalization, the number of people who are dying from this virus. Having the infection itself, as a lot of people have witnessed, doesn't always make you sick. You know, there's a lot of people who are asymptomatic, but we don't know who's going to have severe infection and who doesn't. So we needed a way to try to prevent a significant number of people, especially those at higher risk, like our elderly, like those with underlying health conditions, from having severe illness. And all the vaccines are effective against doing that. And even the Johnson & Johnson, people will see a number that's a little bit lower, but if you dig a little deeper into the information, the number is about the same when it looks specifically at people who have significant illness. Yeah, there might be a few more people who have mild illness with the Johnson & Johnson vaccine compared to the Pfizer and the Moderna. But when it comes to hospitalization, severe infection, and death, the numbers are pretty much the same. And that's really the goal. The Johnson & Johnson vaccine was developed at times when this virus was doing what viruses do, and that's mutate and change. And so it was able to cause a few more symptomatic patients in the studies, but it still prevented people from getting sick and dying. Well, I'm one who believes that knowledge is power. And knowing and understand all we can for ourselves is important. I think it's important to get that knowledge from reputable sources. I don't think that all of what you see in popular media, all of what you see in social media are the end-all answers. So you have to really talk to people, talk to your physicians, talk to family and friends who have some knowledge of how vaccines work and are doing the work themselves. So I think one of the things that you have to do is arm yourself with information. I think that there's a lot of misinformation that's out there, and you have to really be careful. Once you have that information, talk to people who you trust about helping to guide you from healthcare decisions. Your physicians should be a main resource for you to ask questions of. And by doing that, you get to individualize the decisions to yourself. This is a decision that we have to all make as individuals. I'm a believer that vaccines can prevent a lot of illness and death because I've seen it happen. I've been a witness to it, both professionally and personally. And I think that is an important thing for us to consider our individual experiences and thoughts when doing this, but we have to temper that with the education of the facts, not just myth, not just suspicion, but we have to really have a lot of facts as we make those decisions that will affect other people. It's not just about me as an individual right now. It's also about us as a family, us as a community, and us as a country and world when we're looking at something that can spread this fast and cause this many people to be sick. And arming yourself with the facts is important. You're 1,000 times more likely to die from this illness than you are to have significant side effects and death from a vaccine. That's a fact. And we need to make sure that we understand these facts. You know, I want people to realize that something that has killed 500,000 people in the United States alone in the course of a year is unlike anything that we've seen in my lifetime. I hope it never happens again, but if it does happen again, I want us to build a public health system that allows us to investigate and act upon the things that we're learning even more rapidly than what we did this time. Because of beliefs and misinformation, there was a lot of stutter steps and a lot of ways that we could have done a better job. And we need to learn from this in moving forward because it may not again happen in my lifetime, but there's a good chance things like this may happen again. And I want us to be ready.